has been featured in Esquire, NPR, New York Times, Rolling Stone, Newsweek, and more. Thank you so much for being here.
My pleasure.
What made you decide, you know what, I'm going to do abortions?
Somebody once said when you wrestle with your conscience and you lose, you actually win. The reality is that 1 in 3 women in this country by the time they're age 45 will have an abortion.
Amazing.
And it's the most common health care procedure that is offered. It's also one of the safest, but it's also one of the most controversial because it is a decision that is unique to women. My awareness as a physician of what happens to women when that care is not available convicted me around what it meant to be a woman's health care provider and to be a Christian, which ultimately led me to conclude that there was nothing doctrinally or specific about abortion in sacred texts, whichever one you're talking about, nor was there anything that prohibited women from having control over their lives and their bodies to make the same decisions that men are entitled to make as moral agents.
That's amazing. How is abortion a health care procedure?
So when a woman has a pregnancy that affects her health or that she decides to end, if she doesn't have an opportunity to end it safely, anything that risks or ends that poses a risk to your health is a healthcare issue.
I mean, it's a healthcare issue for the baby, the unborn child, in that you're killing the baby.
Baby is a cultural term, it's not a scientific or medical term, and you're not a baby before you're born. Because of our laws, you're not entitled to block a woman from having an abortion, or you're not entitled to force a woman to agree with your definition.
Aren't you taking a life?
I disagree with you. I understand what you're saying.
You are killing an unborn child, right?
I'm not killing an unborn child.
You're taking the life of an unborn child.
I'm ending a pregnancy.
But does that require you to take the life of the child that's in the woman's womb?
I don't define a pregnancy as a child, and
does it have a life? Is it a living?
It is a living entity. It is a life. It is a human being because women don't have puppies, but it is not a baby. And if it were a baby, it would be a person, correct?
So the reality
let me finish.
So the reality is you are taking a life.
So
is that true or not?
Do you want to have a dialogue, or do you want to let me answer your question, or do you want to answer my question?
Answer the question about are you taking a life?
Okay. Yes, an abortion ends a life. If you call the police, will they come and arrest me?
That still doesn't take away the fact that you're taking a life. Is it possible you could be wrong now?
Yes, it is.
Okay.
Is it possible that you could be wrong?
No.
You can't imagine how you can possibly be wrong, and I question myself all the time. Voltaire said
I would
that,
if I were you. Let me do this.
Have you ever changed your mind about anything?
I have.
Okay.
That's why I'm glad that you're at least thinking about the way you feel about Christianity and abortion now and sin and all that, because you are wrong, and by you thinking about it, maybe you get back on the right track.
This isn't about, you didn't invite me. I'm here I came here at your invitation without knowing anything about who you are and what your agenda is. And I didn't come here to have you openly scrutinize what you think my moral compass is. If you want to talk about abortion, if you want to talk about the right of women, if you don't want to talk about that, we can end the interview, and I'm happy to have had this opportunity.
Let me just ask this and then we'll move on. Do you believe that there's good and evil?
I absolutely do.
You do, okay. And is it good to perform abortions or evil?
It's good to perform abortions when women seek them and they need them and they ask me to do it and I'm trained to do it and I provide it for them. Yes, it is good to provide
for women. Is it good for the unborn child?
I don't know what an unborn child is. I know what a fetus is. I know when you give birth, you become a child.
Is it good or evil for the fetus?
I know how to end a person.
Is it good or evil for the fetus?
I don't relate to life in terms of absolute good and evil. So,
do you believe that there's good and evil?
I absolutely do.
You do, okay.
I don't relate to life in terms of absolute good and evil. So,
does it bother you that it might be evil to the fetus?
It doesn't bother me at all because a fetus can't be more important than the woman carrying it.
Get back to this. That's ridiculous.
Right. Okay. It's ridiculous because you don't agree with it, and that's fine. If that's your metric, everything I might say might be ridiculous to you because maybe it's perplexing to you that people think for themselves.
No, it's not perplexing.
But it is.
You're not thinking for yourself.
Okay, well, I'm not thinking the way you think I would think.
You are not thinking for yourself.
Okay, well, I'll accept
One
that.
thing I know for sure, and without a doubt, there's some things I'm not sure about, but the one thing I am sure about, you're not thinking for yourself.
Okay.
How many abortions have you performed in your career?
As many as necessary.
And how many is that?
What difference does it make if it's 1,000 or 100,000?
Well, you don't think that would make a difference?
Okay, what difference does it make?
Oh, let me ask, how many months? Do you do it at the ninth month if the woman wanted?
No, that's not legal.
Where do
and,
you, if it was legal, would you do it?
Well, I don't answer hypotheticals because to talk about an unborn pregnancy as a baby is very inflammatory. Stages of development matter. If you say that a baby and a fetus are the same, it's like saying also an oak tree and an acorn are the same. Is it the same if you step on an acorn as you chop down a 100-year-old oak tree? It is not. And that's why
First
as
of all,
a trained
you can't
physician—
compare an acorn to a baby,
well,
a human being.
Don't get lost in the analogy. That the ability to think in acrylic—
that's not very nice. So I want to know, once you pull this baby out of the womb,
I don't pull babies out of the womb.
After you kill the baby inside the womb,
I don't kill babies.
And you suck it out, however you get it out.
I remove pregnancies by standard medical techniques.
And when you
at 12 weeks, that is a suction procedure.
And when you see that child, when you see that child, does it bother you at all?
It doesn't bother me at all to end a pregnancy that a woman doesn't want, because the woman who comes to me is my patient.
The woman that's having her child killed in her womb, does she give that child life?
Nobody gives anybody life. Life is a process. We all participate in the process of reproduction.
So she doesn't give life. What gives her the right to take a life?
Okay, nobody gave her life. She can't give life. We all are here.
So what gives her the right to take a life?
Well, you know.
So
is there any process, if you wanted to have your gallbladder taken out, would anybody question you? Do you have to get anybody's permission to have anything done in your body?
A gallbladder and a baby is not the same.
Well, a gallbladder is in your body and a fetus is in her body.
I'm making the choice about the gallbladder, or the gallbladder has some problems in making the choice.
And women do the same thing about pregnancies.
A woman who kills her children on the inside is making a decision about another human being's life.
I'm not gonna argue with you. If you want to have I've never walked out of an interview, but if you want to have a meaningful conversation, ask me some meaningful questions. Otherwise, this interview is over.
But I thought the whole conversation had been meaningful so far.
No, because I haven't really. You haven't asked. You have asked me questions that prompted me to answer in a certain way, and then you've offered your critique. Everything has been about what your impression of about who I am and what I do.
You asked me.
Right, I ask you because I'm still trying to figure out what the point of this is. Okay, I don't complain because I have the power of exit. I can walk out here any moment that I want.
Let me ask.
I'm indulging you.
You are the physician plaintiff in a federal lawsuit preventing the closing of a Mississippi-only abortion clinic.
Correct.
Is that true? You know, I went down to Mississippi and protested that clinic. We've been fighting to get that clinic closed for a long time.
That's important. That's unfortunate.
It's going to happen.
Because you are indifferent to what that means to the women, right?
I'm sorry?
There are actually 7 states where there's only one clinic. You're going to go to each state to protest where there's one clinic left?
Don't give me an idea. Should the father have a say-so about his child?
Should the father have the say-so over a process that's going on in a woman's body? No.
Is that his child in the woman's body?
A pregnancy, when a woman is carrying a pregnancy, whoever she decides the paternity is related to, and if they have the kind of relationship where she wants to have that, a woman doesn't have to relinquish control of her body to anyone.
Is that his child inside of her body?
I guess it depends on what state you're in, right?
Is that his child inside the woman's body?
No, because a woman doesn't have property.
You didn't really say no.
No, it's not his child. It's if they continue that pregnancy and give
birth,
it's their child, right?
How is it her child?
When she gives birth. Well, as I said to you, when
you really said no, it's not his child.
It's not as a property as he has some claim.
You put all that extra stuff onto it.
Okay.
You just said no, it's not his child.
It's not his child. It's their child.
Whose child is it?
It's their child if they have a joint enterprise, right?
Should he have a say-so in that?
Not unless he can take all the risks that go with continuing a pregnancy. No.
It's amazing, man.
Okay. Yeah, that can be amazing when you hear that other people can think too.
So you believe you're thinking? Does it bother you that every day between 1,200 to 1,500 black babies are aborted every day?
It doesn't, because I don't abort babies. No, it doesn't.
So as a doctor, did you make more money before you start performing abortions or after you started
What
to
difference would
perform
it make?
abortion?
I'm a board-certified obstetrician gynecologist.
Do you make more money?
What's your point?
Do you make more money? Did you start making more money before you started to perform
I make
abortion?
more money
or
after. I make more money. I make less money than I could make. I make enough money to take care of myself. But
So did
what
you start to
difference does it make?
Did you start making more money after you started to
What
perform
difference does it
abortion?
make how much money I make?
It's important because that might be your motivation.
Well, whatever my motivation is, if I get paid for the services I provide, I'm entitled to get
So
paid.
when did you start making more money? Making money
why does
before
that
or
matter?
after?
I'm a private citizen. I don't have to answer to you about what my finances are.
And why
How much
not?
money do you make?
I didn't ask you how much. I
Tell
asked
me.
you when did you
Tell me.
when did you start making more money? After you
Tell me.
started
Tell me.
performing abortions or
Tell me.
after?
Tell me how much you make, and I'll tell you. If you tell me how much you make, and then I can tell you, because I know what I was making before and after. If you tell me how much you make, I can tell you I was making more money than you do before or after. So that's my answer to you.
Let me ask, what is a man?
What is it?
Yeah, what is a man?
What is a man?
You don't know?
Do you?
Do you know what a man is?
Are you one?
Do you know what a man is?
Are you a man?
Is that your responsibility?
Are you a man?
So that's your
I'm
responsibility?
asking you. You answer me, and then I'll answer you.
No, I'm asking you what is a man?
Are you a man?
So what is love?
What is a man?
What is love?
What is it?
What are you doing? You're not going to answer the question.
I'll answer your
You're
question.
my guest. You're the expert. You're the doctor. You're supposed to be answering these questions.
Well, if
What
you
is a
tell me
man?
what you tell me what a man is, and then I can tell you whether I believe that a man is what you think it is or whether it's not.
Do you know what it is?
I do.
What is it?
What is tell me your definition. I'll tell you if I agree with you.
You're not going to answer that because we're running out of time and you're wasting my time. So you don't know what a man is?
I do.
What is a man?
What kind of test is this? What is a man? What is a man?
Apparently you don't know what a man is. So let me ask.
Okay.
Do you love black people?
I love all people.
And what is love?
What is love?
Are you not going to answer that either?
Well, see, you're asking me rhetorical questions, and I'm returning your rhetorical question, and then you don't like a rhetorical question, but you want me to answer one.
Do you love the unborn child?
I love people.
How about the unborn child?
Unborn children aren't people. I don't know what an unborn child is. I know what a fetus is. I know what a pregnancy is, but I don't know what.
Do you love the fetus?
I love women and their pregnancies. If a woman's carrying a fetus and she wants to continue, I love and will support her ability to support that. If a woman's pregnant and is carrying a fetus and she no longer wishes to carry that pregnancy, I love her enough to help her accomplish her goal safely.
Amazing. This past June.
But let me ask you a question. How can you say you love a pregnancy more than you love the woman carrying it?
I love both.
Okay, so when it's not in the best interest of a woman to continue a pregnancy, how can you prioritize the fetus over the woman who's carrying the pregnancy?
Because the child should have a chance to live
What about
as well.
what about a female child who's carrying a child? Does a woman have a right to thrive?
She has a right, and so does the unborn child.
Okay, and so when those interests are competing, whose interests
They're
are
not
important?
competing.
Are you a doctor? Are you a doctor?
Only in the ego mind
you a
of the
doctor?
selfish woman that want to kill the child.
So a
You
woman,
don't have to be a doctor to know that, man.
you don't have
This past June, you were interviewed as part of a Shout Your Abortion event.